What is ballooning of the foreskin? So this is when you pee, the foreskin swells up as the urine is passing from the head of the penis. If this happens, it usually means that there is some form of phimosis. So this means that the foreskin is tight. If you're a young boy or a teenager, it's more likely that this is a congenital phimosis, which is normal. It happens from birth, but usually from the age of about 3 years old, the foreskin starts to separate from the head of the penis. And in most people, it's fully separated by the age of 10. But in others, it may remain attached for longer into the teenage years. In some adults, they may get an acquired phimosis, which means that they used to be able to move their foreskin freely over the head of the penis, but now, for whatever reason, it's become tighter, and now they can't pull the foreskin back. So what ends up happening is when you try to pee through the head of the penis, the gap from the foreskin is smaller, and therefore the force with which you're trying to pass urine is too much. So it kind of gathers under the foreskin, between the foreskin and the head of the penis. Your foreskin will balloon and the urine will pass out. If this is happening, it increases your risk of getting something like balanitis, which is an infection of the head of the penis, just because it means that the area between the foreskin and the head of the penis will never fully dry, and you wouldn't be able to really clean it properly. If this is happening to you, first, please do not try and forcibly pull back your foreskin, because particularly in children and teenagers, it can cause more damage, it can cause pain, it can cause scarring. And the second thing is go and see a doctor, because first of all, we need to confirm the diagnosis. But if it is something like a phimosis, we can give steroid creams, we can refer to urology, we can refer you for a procedure where they can stretch the foreskin. They can even, in some situations, do a circumcision. And if there are any signs of an infection, we can treat that. But the most important thing is go and see a doctor.